I'm at the American Naturopathic Medical Association convention, and I want to ask you a question because I'm going to be talking about this as a guest speaker on Sunday. Why are so many people watching their health decline? Something is wrong with the way we think about health. We have more doctors, more specialists, more medications, more testing, more technology, and more health information than ever before. And yet people are watching their health slowly decline. They gain weight, their blood pressure rises, and their energy drops, and their sleep gets worse. Their blood sugar begins creeping upward. Their triglycerides rise, their waistline expands. Their liver gets fatty, and their memory is not as sharp. And somehow, year after year, they are told some version of, well, let's just keep an eye on it. That sentence should bother you, because it really bothers me. Because the question is, what exactly are we waiting for? Are we waiting for your blood sugar to become high enough to call it type 2 diabetes? Are we waiting for your blood pressure to become high enough to require another antihypertensive medication? Are we waiting until your liver enzymes become abnormal? Are we waiting until enough symptoms are abnormal and the numbers stack up that now someone finally gives the problem a diagnosis or name? Because there is a difference between watching something progress and actually trying to understand why it is progressing in the first place. And that is what I want to talk about today. Hi, I'm Dr. Kim, a board-certified naturopathic doctor. I've been in clinical practice for over 40 years, and I review blood work almost every single day. Today is no different, even on vacation here in Las Vegas. I want you to understand your blood work and know what to do when the numbers go wrong, so you can change your future before type 2 diabetes does. And today we're going to go bigger than just one blood test, because I want you to understand how someone can be seeing their medical doctor, getting their blood drawn every year, taking medications, and doing everything they think they're supposed to do, and still watch their health move in the wrong direction. It is a real physical decline. We have confused monitoring with prevention. There is a huge difference between monitoring a problem and understanding what is the driver behind it. Monitoring sounds like this. Your lab number is a little higher. We'll recheck later. Your blood pressure is creeping up. We'll just watch it. Your hemoglobin A1C is getting closer to pre-diabetes. Come back in 6 months. Your triglycerides are rising. We repeat the test next year. There are absolutely times when monitoring is appropriate. But here is the question I don't want you to forget. Why is your health and lab test results changing in the first place? That question can completely change the metabolic conversation. Suppose your fasting glucose was 82 milligrams per deciliter several years ago, and over time it became 89 and then 96. Those numbers may not individually trigger a diagnosis, but I want to know why the direction changed. And I especially want to know what else changed with it. Did your waist circumference increase? Did your triglycerides rise and did your HDL fall? I saw somebody's labs today like that. Did your blood pressure increase? Did your hemoglobin A1C move upward? Did your energy change? Do you now have a fatty liver? Do you have a high fasting insulin result or any insulin result? One number by itself is a snapshot, but several numbers moving in the wrong direction altogether over several years can tell us a story. And the problem is that we often read that story one sentence at a time, and this is the crazy thing. Disease does not begin on the day of diagnosis. This is one of the most important things I want you to understand as you watch this whole video. Type 2 diabetes does not suddenly appear the day your hemoglobin A1C reaches 6.5%. I want you to think about that. A hemoglobin A1C of 5.7 to 6.4% falls into the pre-diabetes range. At 6.5% or above, and these are lab tests, when diagnostic criteria are met, it can be diagnosed as type 2 diabetes. Those cutoffs are useful. We need criteria, but think about it. This is what would have to be true if disease literally began at that number. At a hemoglobin A1C of 6.4%, you would have one metabolism, and suddenly at 6.5%, you would have a completely different body. Of course you don't. Your metabolism has been moving along a continuum. The diagnostic line tells us that you crossed an established threshold. It does not tell us that the process started that morning. The same principle applies elsewhere. Heart disease does not begin the day you have a heart attack. Fatty liver does not begin the day someone sees it on an ultrasound. Hypertension does not begin the morning the diagnosis finally appears on your chart. These conditions develop over time. There are changes, metabolic changes. There are compensations. There are warning signs. And very often, there are opportunities to act before the disease becomes much more difficult to ignore. We have become very good at naming disease. What I want you to become better at is recognizing the road that may be leading toward it. You know, your body is always compensating. Now let me explain something that I think makes this entire conversation much easier to understand. Let's use insulin resistance as an example because I'm the insulin resistance doctor. Insulin is a hormone produced by your pancreas, and one of insulin's major jobs is to help move glucose out of your bloodstream and into your cells, where it can be used for energy or stored for later. But over time, these cells become less responsive to insulin's signal. That is insulin resistance. Now your body has a problem. It still needs to control blood glucose. So what can the pancreas do? It's a real important question. You know, it can make more insulin. That's what it does. And for a while, that can work. Think about it this way. Imagine that yesterday your body needed 1 unit of effort to get a particular job done. Today it needs 2. Later it may need 3. This job is still getting done, but it is taking more effort to accomplish the same result. This is called compensation. So your fasting glucose might still be at 92 milligrams per deciliter, and your hemoglobin A1C may still look acceptable. And you know, you may think, my sugar is fine, and you know, maybe it is. But glucose doesn't necessarily tell us how much insulin your body needed to keep it there. That is one reason I talk about the lab test fasting insulin. It gives us another piece of the metabolic picture. It's not a perfect test, and it's not the only test that matters. And one fasting insulin result should never be interpreted in isolation. But when I'm trying to understand someone's metabolic health, I want more than one piece of the puzzle. I was working with someone today and her doctor refused to do a fasting insulin test because eventually, if insulin resistance progresses, the pancreas may no longer be able to compensate adequately, and then glucose rises, hemoglobin A1C rises. I saw that today on the lab, and prediabetes appears. Oh, it's not sudden, and eventually type 2 diabetes follows. The physiology did not suddenly change overnight. The process was already underway. You know, you've learned a lot so far, and here is why I want you to take my 1-minute insulin resistance risk assessment. It's free. And if insulin resistance can begin before your blood sugar becomes clearly abnormal, then the real question is, could some of the patterns we've talked about today already apply to you? And if you have not crossed into type 2 diabetes, that's what the assessment is designed to help you think about. It's not a diagnosis by any means, but it's a quick way to look at risk patterns you may already have. You know, I like to know if I have risk patterns that can be easily overlooked. When you are only watching fasting glucose or hemoglobin A1C on a lab result, the link is below my video. Take it, look at your score, and if you would like, email me your result. Here's another reason people can miss what is happening. We divide the body into categories. High blood pressure goes into one box with one specialist. High triglycerides goes in another with another specialist. Fatty liver goes in another. Weight gain goes in another, and then we're into bariatric surgery. Elevated blood sugar goes in another. But your body does not operate in boxes. Imagine a woman in her 60s, and that was me. I'm 65 now. First, I started gaining weight around my middle. Then my blood pressure began creeping higher. And a few years later, about 62, 63, my triglycerides started to elevate. My glucose started rising. And then I discovered that I have a fatty liver. Those can look like 5 unrelated problems: a weight problem, a blood pressure problem, a cholesterol problem, a blood sugar problem, and a liver problem. That's a lot of problems, but when several metabolic abnormalities begin appearing in the same person, we need to step back and ask ourselves, could these things be connected? That does not mean insulin resistance causes every condition, by no means, but insulin resistance can be associated with a cluster of metabolic abnormalities, including increased abdominal fat, elevated glucose, high triglycerides, lower HDL, I saw a lab today like that, and elevated blood pressure. So instead of only asking, how do we lower this particular number, I also want to ask, why are these particular problems appearing altogether in the first place? That is a very different question. Now I want to talk about the word normal. This is a big one. A lot of people see that blood test result fall inside of a reference range and assume that means there's nothing to think about. Everything's fine, normal. But a reference range is primarily a tool used to help interpret a laboratory result. It's not a promise that every number anywhere inside that range represents your personal best health. And it definitely does not tell you whether your number has been moving in the wrong direction for 5 or more years. That is why I care about trends. If your fasting glucose has gone from 82 to 89 to 86, I do not want you staring only at the latest result and asking whether there is an H next to it. I want you asking what direction your labs are going. I want you to read your labs. What was your last hemoglobin A1C? What was your triglycerides, HDL, blood pressure, and weight? What was your waist circumference, liver enzymes, and fasting insulin? Was fasting insulin even tested? Normal today does not erase the trend that you got there, how you got there. We have normalized slow decline. This may be the most uncomfortable part of this conversation, normalizing slow decline. I'll say it again, one more time. We have normalized slow decline. We joke about gaining weight with age. We accept losing energy. We accept poor sleep. We accept rising blood pressure. There's a pill for that. We accept getting weaker. We accept one medication becoming 2, then 3. Yes, aging changes the body. I can't deny that. But aging and metabolic deterioration are not the same thing. You should not automatically assume that every decline is inevitable simply because you are getting older. Sometimes what gets blamed on age is actually a modifiable metabolic problem. And that distinction matters because if you believe decline is inevitable, you stop fixing problems, you stop asking questions. How did I get here? You stop looking for causes, and you'll stop believing anything can change. If you have blood work and you are looking at it thinking, nobody has ever explained what all of this means together, start with my 1-minute insulin resistance risk assessment below. It can help you see whether some of the patterns we've talked about is you. And if your score raises some questions, or if you want help looking at your labs, in context, you have to look at everything in context. I offer a 30-minute coaching call where we can look at what is happening, identify the questions you should be asking, and help you understand what deserves your attention. That link is below this video also. Here's what I want you to do. I do not want you thinking the answer is that you need 50 laboratory blood tests. You don't. You do not. Start with what you already have. After this video, pull out your last 3 sets of blood work for the last 3, 4, 5 years if you have them. Or go into your portal and pull them down and print them. Take a piece of paper and make 3 columns, oldest, middle, and newest. Write down your fasting glucose, your hemoglobin A1C, your triglycerides, your HDL, and if you have it, fasting insulin. Then underneath that, write your weight, waist circumference, and blood pressure. Now look across the page. Do not just ask whether every number has an H or an L beside it. Ask yourself, which direction am I going? Is my glucose gradually rising? Are triglycerides moving up? Is HDL falling? Is my waist getting larger? So here's how to properly measure your waist. Use a soft measuring tape and measure around your belly button area. That's the correct way. Write it down and now ask yourself, is my blood pressure trending upward? That is information you can actually use. And then ask better questions of yourself and your doctor. Not just, is this normal? Ask, am I improving? Or are my lab values getting worse? You know, lab tests don't lie. What could be driving this change, you need to ask, and what can I do now before this becomes a diagnosable disease? Please don't wait for a diagnosis to give yourself permission to act. You do not need to wait until you have type 2 diabetes to start improving your metabolic health. You do not need to wait until you have hypertension to work on food quality, movement, sleep, strength training, and body composition. You do not need to wait until fatty liver becomes advanced before caring about your metabolic health. You do not need permission from a diagnosis to take your health seriously. And that may be the biggest point of this entire video. A diagnosis should not be a starting gun. By then, the race may have been underway for many years. So if you have been watching your weight, your blood pressure, energy, glucose, or other metabolic markers slowly move in the wrong direction, take my 1-minute insulin resistance risk assessment below. It's free. Why? Because insulin resistance can develop years before type 2 diabetes is diagnosed. And the assessment may help you recognize whether your current pattern deserves a closer look. Take it, look at your score, and if something concerns you, excuse me, I'm at a pool in Las Vegas, email me your result. Sometimes the most important first step is not ordering more tests. It's finally recognizing the pattern that has been there all along. Your health usually does not collapse all at once. It changes gradually. A little more weight, a little less energy. You know, I sound like a broken record. A slightly higher blood pressure, a slightly higher glucose. One medication becomes 2, then 3. And every individual change may seem small and insignificant until you look back 10 years and realize how far things have moved in the wrong direction. That is why I do not want you simply watching your health. I want you to understand it. Because the earlier you recognize the direction your health is moving, the more opportunity you may have to change that direction. And that is the difference between waiting for disease and actually working to prevent it. If this has helped you think differently about your health, subscribe to my channel so you don't miss the next video. And remember, your numbers are not just numbers. They are clues. Learn to read them earlier rather than later. I'm Dr. Kim, the Insulin Resistance Doctor. I'll see you in the next video. Know your numbers, change your future.